Thanks, Tom. So I actually planned for this to be really more of a discussion and hopefully to generate some ideas, some feedback, and I'm hoping this can be a little bit of an informal discussion. But I do have some slides to set the context. I will pull up. Oops. Okay. So I'm hoping today we can, talk a little bit about what is racial justice, right? This is something that I think we've all been having a lot of conversations about in a lot of different types of spaces. And what I found is the space that we're in really guides a lot, what that conversation feels like and looks like, and how we think about it, and where that conversation ends up in terms of, if it stays in that academic realm of, defining and analyzing, or if it, stays in, kind of that a realm of, recognizing impact, recognizing disparities. What I haven't found in a lot of spaces that I'm hoping we can sort of generate some energy today is spaces where that conversation really leads to some solution generating and some productive thinking around what does it mean to address these inequities, right? So a little bit of background on CERA, the Council for Cultural, Ethnic, and Racial Affairs, which I'm co-chairing and which is, sort of guiding this work. We started out as a committee of the executive committee of SCRA back, a couple decades ago, but then in 2017, developed into a council to really have a voice on the executive committee and to be able to take sort of a guiding role in thinking through how our systems, how our structures, how our decisions are related to systemic racism or dismantling systemic racism, and really have been sort of driving towards that role and that goal of our group. And so where I come from in terms of my background in child psychology, in doing community-oriented clinical work, I've really been focused on kids, and I just wanted to sort of throw up some of the ways that I think about systemic racism, and when I hear systemic racism, what issues come to my mind, right? So the school to prison pipeline is a big one that I'm sure some of you are really familiar with, have heard about in the media, in how racialized discrimination in schools can contribute to the overpopulation in our prison system from Black and marginalized communities. So in my work, though, I've really, come to realize that these disparities, that we're seeing at the school level, kids are also often entering schools already exhibiting significant health and educational disparities. And so this pipeline really starts earlier, right? And so when we really have a more big picture view of how racialized disparities affect communities as a whole, one prime example is really just looking at how COVID has affected communities across the United States, and seeing with all of the attention on the recent pandemic and all of the data that we have seeing how it's really had disparate effect on Black communities, specifically those that are more racially segregated, and particularly you can see from this map in the South and Southeast part of the United States. So the red and brown being counties that have disproportionately higher Black residents compared to other folks, and then the darker brown being where there's been higher rates of diagnoses on the top map, or deaths due to COVID on the bottom map. And there's a lot of different models out there to think about how these racialized disparities come about. So on the right side, I have Alegria et al. Put out a model in 2011 that's really useful in thinking about healthcare disparities at the systemic level, and all of the different factors that really go into then creating and maintaining these disparities. And you can see there's a lot on here. So this is a really complex problem that we're talking about, right? I'm not going to go through all this, but just wanted to really give a bird's eye view of when we talk about racial justice, when we talk about inequities, how complex and interconnected all of these systems really are, and what we're describing. And so when we think about community level disadvantage, how it affects the individual, family level, and then how that's affecting children's home environments, children's access to resources, and perpetuating this cycle that we see with the school to prison pipeline and those kinds of things. And so here's another way of looking at it. So when I see all of these different areas of health disparities, and these areas that really drive some of the disparities that we see across the lifespan, I also see all of these as potential areas for intervention. And so that's what I want to kind of the lens I want to use today when we think about this and look at this. All of the potential areas of intervention, and so keeping that in mind, I just had a couple of those memes of about equity and equality, but I kind of want to jump ahead actually to our main question, which is just what constitutes as action for racial justice. So in CERA, we just launched this initiative to try to fund grassroots efforts to implement some kind of action for racial justice and addressing inequities in marginalized communities. I'm focusing because of my context of and my work and the populations that I've been most interested in, specifically on inequity here in the U.S. But want to also recognize, so our request for proposals is available for any organization or any community to take advantage of. So it doesn't have to be situated here in the U.S. or be concerned with specifically our racial hierarchies that are here in the U.S. And the disparities that we see here. And so thinking about this growing issue of racial disparities, how that's being perpetuated in multiple systems at multiple levels, and driven by historical inequities that have not been adequately addressed, at least here in the U.S. And for other communities, there's been some instances of that as well across the globe. How can we address this need for immediately actionable solutions? How do we define action when it comes to wanting to inspire work in this area? And so those are kind of the questions that we've been throwing around in CERA as we put out this initiative. For those who haven't seen it come through the listserv, our initiative, it's called the Action for Racial Justice and Equity Fund. And we're hoping to fund at least 2 projects this year, and when we see what kind of response we get, hopefully can grow this initiative over the coming years, that really center marginalized voices in the creation, in the development and design of these solutions. And we recognize too that especially in the recent past, a lot of our efforts have been focused on academic endeavors and on research and learning more. And I think there's so much that's been generated out there. We wanted to shift our focus to action. So what does this look like? How do we define it? These are some of the conversations I'm hoping we can have today. And I'll open it up to see if anyone has some thoughts at this point.
Questions, thoughts?
I'm happy to warm us up and get us started on questions. So I guess I'm trying to envision the kind, and I think that's probably part of what we're trying to do here, is start envisioning the kinds of projects that might end up being submitted. And full disclosure, I am an academic. I'm coming from an academic space. And so I'm wondering, I guess here's a question we can chew on. So if we're looking to go after racial justice and we're trying to figure out what counts, I wonder about things that address some of the inequities that you've discussed. So for example, communities that seek to bring fresh produce into food deserts, right? So that's a good example, I think, of an area of inequity that's clearly addressed, but isn't explicitly about racial justice. If they're bringing it into one community, they're focused on that group, and food deserts tend to be, overrepresented in Black or Hispanic, lower income, so, but it's not about racial justice per se. And I'm wondering if that's the kind of project you're looking for, or if there's something else that's a little more explicit or direct that might be a better fit.
Great question.
And I think we, in our call, really kept this pretty broad, recognizing because there are so many different levels and ways of, intervening, right? To not lose those sort of community level, really sort of local efforts, right? Local efforts to address, systemic issues. So that's I like that example. Because I think a lot of our conversation also has been on, larger efforts, policy implementation as well. We've, had some thoughts about and discussions about, how does, how do we encourage grassroots efforts to at that level of engagement as well? And so I think there's so many different ways to intervene. Kyra, I see your hand. Love to hear your thoughts.
Yes, I was just going to say that I think this is a great initiative. As I was listening, I think about kind of the space that I'm in, which is the maternal infant health space. And right now, at the community level, and even I would say at the national level, there's a sentiment, a resentment, if you will, around just funding opportunities that a lot of Black-led maternal health organizations are leading, but they're being swooped up by white-led organizations or organizations that maybe tokenize some of the grassroots organizations. And so I just wanted to just provide that comment in that I think this is a great opportunity and really opens up spaces for groups, regardless of maybe mission space, but who are really on the ground doing the work and can support that work. So I think that's great.
Thanks, Kyra. I'm curious to know, for those of, wherever you're situated, whether it's kind of in the academic realm or in some of those practice spaces, what types of projects have you seen being implemented around action for equity, and just to have some examples thrown out in terms of the range, and kind of get a sense of what comes to mind when people think about action for equity and action for racial justice.
So kind of to answer your question and thinking about Carolyn's question or comment around what constitutes racial justice. So I think being having this conversation about what is action, et cetera, and Sindhia, you mentioned policy, which makes sense. So I'm wondering, though, thinking through it, if it's a broader issue in terms of food insecurity, I think that Carolyn was referring to and providing fresh produce or food in general to what we classify or what we know as food deserts, but not to one specific place. If it impacts communities of I would say BIPOC or however that identity might be identified right now, constitutes racial justice on a broader scale if it's indirect, if that makes sense. Somebody can feel free to help me out here with the direction I'm thinking of, because I think it is important, and maybe, and I don't know that we did this, Sindhia, in the call for papers in the RFP, is to identify what we meant by action and what we meant by racial justice. And so thinking about this moving forward in our language, not just in this RFP, but I think overall, we might want to do that. And for all of us, actually, this isn't just, indicative, or I'm referring back to CERA, but I'm just thinking about it because it brings up a great point around language and how do we unify it, or how do we become unified in how we're thinking and what can push us forward, right? Because we're all here in light of the same movement, or participating in this same movement. So it might be a good space too. I think we have a little bit of time. I certainly don't want to monopolize the space, but I do think that having this conversation would help us, not just in the RFP, but in general. What do others think? Are there other thoughts around what I'm probably not articulating in the best way, but certainly flushing it out as I'm thinking about it, right? Being a thinker and a talker at the same time, but I think it's important.
Mhm. Yeah, and I'm sorry, I realized that like some of the parts, I took the slides down because I'm pulling up the RFP that we have and to pull up some of the language that we have in there.
Yeah.
And realized that the parts that I had included in my slides were maybe not the most helpful parts for our debate today, or discussion today. So I see when we defined racial justice pretty vaguely in the RFP, maybe, or we can kind of discuss that for the purpose of this funding opportunity, we define racial justice as the inclusion and centering of the interests and experiences of particular racial or ethnic peoples in spaces where they have been historically excluded from decision making that has a societal impact. And so that's the language we used, and I think that's part of the discussion is what how can we talk about it and maybe define it in a way that inspires action.
I would like to invite Kyra, is she still here?
Yeah, I think hands are up too. Tom, yours was up and Noe's hand was up as well.
Why doesn't Noe go first?
Okay.
Oh yeah, okay. Yeah, thank you. Yeah, I really appreciate this conversation and this space. So I think, I don't know, as I'm listening to people talk, and thank you, Jerry, for your comments and everyone else. I think, I don't know, I mean, I'm located in South Los Angeles. I do youth work. So it's my attempts to do more, and I'm learning a lot right now about making sure that I do the work with young people in the way that I'm not, it's not top down. It's not me sort of perpetuating like my own ideas and biases of what should be done in South. And I'm not from South Los Angeles. I'm originally from the border from Texas and Mexico. So learning a lot about the community. So I think about like the roots of the problems of the, the systemic issues and, working with young people. And I'm now been working on a grant proposal and it's for NIH. I'm in a medical center. So it's like, pressure to apply for NIH grants. And then that learning of tension of what the NIH philosophy is, which is in many cases not very welcome or, kind of align with what us folks in community psych are trying to do. So it challenges me to kind of think about the way that people understand what like action or social justice or racial justice means. And in different spaces, it means different things. I'm thinking of like for young people, kind of assess their critical consciousness and understand, how they are in the process of learning about, these different issues of oppression and injustices and in their own experience, like lived experience, what challenges they face and how they see the systems and what are the roots of the problem. So I also see like, people maybe, and some point, some organizations that are maybe not necessarily coming at it from what kind of a lot of us sort of in the spirit of doing the racial justice work within our organization or our field, maybe wanting to help in terms of improving the situation for food deserts, but not necessarily having the lens of racial justice or social justice as like getting people access to food. Would that still be, considered a racial justice action? But if it's not, I think I'm trying to think about like, if it's not inclusive of the folks in the community, inclusive of their voices, and really thinking about like, what is the reasons why those food deserts exist to begin with, and why, you know, those inequities continue to perpetuate and get exacerbated, like with the pandemic and further economic issues, then I think it's critical to step back and think about this aspect of, you know, really delving deeper into the roots of the roots, like almost like what's causing this, and then tackling those issues. So in part, it's because of my work with young people and doing participatory and critical consciousness that I examine, like, you know, the growth in the young people and their experiences and learning about these issues and the tensions around different perspectives. And then being in a medical center where I've now recently encountered, you know, the challenges with certain people, you know, having ideas of this is what we should do for health equity, and then not necessarily being aligned with how I understand what that means in terms of on the ground working with partners in the community. Yeah, those are some of my thoughts.
Okay, I think that brings up, you know, a really great point about, you know, when we do, actually multiple great points in there. One, that, you know, sometimes, you know, we're doing this work, but not thinking about it in terms of racial justice, but maybe addressing some inequities. But then when we're not thinking about it in terms of racial justice, you know, that we're missing some major context there, that we may not be including the right voices, right? And so the importance of really recognizing where these inequities are coming from, framing, you know, our work in those ways, that it allows us to make sure that the right people are at the table, the right people are generating some of the solutions and leading the charge, and that we're not doing for communities, that we're doing with communities, or that we're supporting communities in their efforts to thrive. Yeah. Thanks, Noe. I think Tom, yeah.
I think of two specific examples. One where we were working on a REACH grant, which was all about racial justice in a series of communities. And more recently, Kyra and I working with a national organization and local variants on infant mortality and maternal health. And when you get down to the specifics, it's very complicated. So in the food desert, we would have communities that do wonderful things. You know, they were mobilizing a community to bring in a grocery store because they didn't have one. And it was a poor community of color. So it was a great, and they were brilliant at it. But they were both doing that at the same time. They were bringing in trucks with local food access. So there was multiple levels. And the level that would have most impact was the hardest level, getting the grocery store to agree to come in, because they didn't see it as profitable. So they were brilliant. They created postcards that said, if you build it, we will come. And they had everybody in the community send their receipts for the month to the major agency that then said, you know, on a monthly basis, we've got, you know, $170,000. I have no idea what the amount of money was, of sales that we're ready to give to you. So they were working at systems change, but they were also working at the level of more grassroots stuff by doing the other. And then in another community, they were trying to, again, a community of color in the same REACH grant. This was in Connecticut now, the first one was in Massachusetts. They were working on the small grocery stores and trying to have them carry better food in these communities. Fascinating stuff. And we said, well, let's see what we can do to support these grocery stores. This was a Black community that was doing the organizing. And they said to us, not so sure. The stores are owned by various Asian groups that don't hire our kids to work in the stores. And now you're deep into all the racial complications in a community. So, but it's, you know, it's where we're going to learn. And I think it's very hard to get mini grants into communities that start to grapple with this stuff and then support them. And in the maternal child stuff, and Tyra May has her hand up, so maybe she'll comment on it. We have at the one level, a coalition that's working nationally that has all the big shots, very powerful groups that only wants to look at policy and advocacy. And then we have the grassroots groups who are saying, you know, the doulas, we've got people here, but they come to me and they don't have housing, they don't have food. So I need a community health worker who's going to follow up. So I need the policy to be more community health workers for me at the grassroots level. Now you start to sort that out. And if you have the answer, let Kara and I know. But it gets very complicated and messy when you want to deal with the big issue of racial justice at all those levels and want to do it in a grassroots way. And I love doing it, but every time I start tearing out my hair. I don't have much left. I don't know if Kyra, you want to follow up on that, or you're going a different direction.
I'll wait till Al. I know Al has had his hand up, so I'll go.
Go ahead, Kyra. It's all right. I'm on a different topic.
Okay. Well, I was just gonna say, I was trying to, listen to make sure I understood what the question was. So I had two comments to that. One, I guess I'll start with my second one, which is related to what Tom just said, because that's exactly how I was thinking, action as defined by community, because, even if that means like meeting direct service or direct need, because I think about the context of Texas with regard to maternal health and being basically, now an outlaw state, to the point where even, I think from a public health and prevention standpoint, we think about direct service not having an impact, but in spaces like Texas, having Pampers or having formula or having, a fund that is developed by doulas for Black women or other women of color getting access to doula care, like that's massive. Even though maybe in the grand scheme of things that traditionally textbook can be considered low impact, but in this space, it's huge impact. So I think about, that defining of what counts as community action being really driven by the community, and what matters in that context. And so the other piece is, I know we were talking about language, racial justice. I guess I just think about it as maybe in an explicit way of explaining it is racial justice at the intersection of social determinants of health. Because I think taking away racial justice, you lose something there, right? And so, but what we really are talking about is racial justice in the context of these other things. It's not isolated from these social and structural determinants of health and determinants of health inequity. So those are just my 2 points. Thank you, Al, for the grace in going first.
I wasn't participating in the conversation for a while because I was busy copying the RFP and forwarding it to the leader of the local Black collective and the Urban League. And I told them that if they had questions, they could contact me. But Cindy, I need to know if it's okay if potential applicants contact you. And if so,
absolutely. I'll drop my email in the chat. Yeah.
Okay, please do. I think what you're trying to do is important, but I really think we have to start where it should start, which is at the community level. Get this thing off the screen.
Yeah, I think these are all great points, and I think it's what we are hoping for is to be really shifting the focus to really looking at and garnering leadership at the community level, and being able to identify those who are situated in the community who can who have the experience that will really be able to identify the right actions, the right solutions for them, for their communities, and And I think, you know, our hope was that we're really focusing on, you know, what are the ways that we can identify those avenues of reaching those organizations as well. I really appreciate, Al, you sending it on to one of your contacts, and you know, want to kind of post that as sort of our second part of our discussion is how can we you know, take this type of resource and make sure that the groups that need it, that are doing this work, and that we need to be leading this work, are aware and connected.
One other question. You started out talking about the school to prison pipeline. Have you been in contact with Christopher Beasley? Who's working at
Not
the college?
directly, no.
He's working on that issue at the college level and succeeded in getting APA to drop its bar against people who have criminal records joining APA. You might want to contact him. He's at UW Tacoma.
Thank you. Yeah. Yeah, I'm familiar with his work, so I definitely will make a note to contact him.
So on that same note, Al, that makes me think too about groups that we may be missing. For one reason, are we approaching what we hope to really gain or hope to get in terms of respondents from too much of an academic lens versus a practitioner lens? That's a question I'm asking this group. What are your thoughts about? I don't have the RFP in front of me, but it does make me think about we're missing groups of people. And even though it's on the SCRA listserv, I wonder who, to Al's point again, who sends it out, even if it doesn't apply to them and they're purely academic, right? Kara, saying to your second question, I think definitely sharing on social platforms for reach and asking folks to share with their networks. I can too as well on social media or LinkedIn or other groups who are totally community oriented or community practitioners, not necessarily having gotten their education in community psych. And I think it's important that we do include those groups. And Tom, this reminds me of working around the competencies, inviting community members in. There is a whole network of people that we don't connect with. And could we do better at that by sending out the work at the same time? Is there a better way to frame it? So these are rhetorical, but not questions, right? For us to engage in here, I think is important.
If I read the RFP correctly, it's two $1,500 grants. Is that what we have?
Yep, that's right.
Yeah, and I, as someone who works in communities, I mean, I love this idea. And the Practice Council did mini grants for years with community groups. If we're asking a community group to do any serious work and we're offering them $1,500, it feels like it's edging on not very respectful if we expect them to do much for that money. Now, that doesn't mean, I don't mean that in as negative a way as it sounds. I think it means that if SCRA is serious about doing this, these amounts of money have to be more like $5,000 or $10,000 for it to be worth the grassroots group's time to start to do stuff, because this is, you know, going to cover postage. It's not going to go much further than that. And I think it's a very important effort, as was the effort with the mini grants in Practice Council, because we are SCRA and we're talking about the A. But when we're talking about the A and we say, well, we have, $1,500 for 2 communities, whereas there's some research fellowships that are going out that are for much, much, much more money, then I think we're back to the imbalance in SCRA. So this is not, I don't want this to be heard in any way as critical, but as much as a need for us to, put some real money behind this, we believe it. Does that make sense, or is that just too difficult? We have a lot of quiet people on this call. Let's hear from them.
What challenges the group to raise money to add to the pot? Yeah.
Well, if you're spending it on research, you can spend it on this. And the Research Council got some big bucks.
Ah,
I think that's an excellent point too. And then one, that also brings us back to, in CERA, we've been, kind of talking about our role in, thinking about action for racial justice, right? In terms of what we can do, outward facing within communities, and what we can do within internally within SCRA, right? And I think that's a really great point, Tom, about advocating for larger funding streams.
So I have a quick comment to that. I agree with Tom, but I also think that that maybe the framing is that it's maybe seen as more of a seed funding towards something that's already ongoing. And that kind of goes back to one of my first comments about what tends to happen with whatever funding you're talking about, but especially now with racial justice or any of that, and who tends to swoop up those opportunities. And I think part of what creates that problem is maybe lack of specific language about, we're looking for things that are already set in motion, because again, those who are on the front lines are already doing the work, even if that means that that's an expansion of the work that they're, if they need to expand it or go in a slightly maybe newer direction, but don't have the funds to do it. I think sometimes when there's inadvertently with certain funding opportunities, there's a subtext of, we're looking for maybe new projects, which maybe some are, but I think when we say that, sometimes that opens up the gates for maybe groups who haven't been doing the work. Oh, let's do this. And so maybe that's just something to, I guess, contribute to this conversation, and that how it's, so to Jerry's point, kind of how are we framing the opportunity? Is it that projects that are already ongoing, who maybe just need that extra, seed money, that extra push, or prioritized? And I think that's also maybe another way of incentivizing groups who are already doing the work. Because I'll tell you now, if I see opportunities all the time, but sometimes people don't even go after them because they either based on experience or maybe just, assumption about who's going to get it anyway. So why should I put forth the resource and the effort to apply for it if I have a sense that it might go to, whoever, versus those who are actually doing the work?
I think that's a great point, because I think about my days as an executive director in nonprofit orgs, and a lot of RFPs come out with if you're giving, that level of money, it may have contingencies across what your budget is, your org budget. And that makes me also think about if it's grassroots led, right? If it's youth led, we see language like that sometime, or if it's community, not community driven, but even members of the community, right? Rather than outside leadership, et cetera. And I really like the framing of existing programs that are in existence, and you need to like balance the budget, and this funding will help do that. There's a number of ways really that it is important. It is the lens that we look through in terms of it being the amount of money can make a difference between a balanced budget. It can make a difference between, oh, I know what else I thought about, even in action, if it's a PAR approach, for example, maybe there is incentive for, what are they, participant incentive, right, for gift cards, or, you know, if each respondent gets a certain amount of dollars or something to that end. So I think the more specific we may be in the language may get a better reach or outreach to, you know, who can use it and who won't be afraid to apply, thinking that a larger organization, larger community-based organization, et cetera, will get the funding anyway. So we're and again, I'm thinking about my niece who is just starting a nonprofit org and could use $1,500 for like planning grants, board retreats, or, you know, something to that end. So there are a number of uses definitely that I think some orgs can benefit from.
When SCRA does mini grants like this, what we've seen is that a member of SCRA reaches out to some grassroots group that they know and partners with them to bring them into this process. So I think the advertising has to go to the members to do what Al did or others who can then bring people in, because no one's they have no idea who we are. $1,500, they're not gonna even think about applying. But you can say to our members, who are you working with where $1,500 would move them along the line of racial justice and systems change. And some will have some money, because no one wants to turn down a gift of $1,500 if someone calls you and says, hey, I think I can get this for you. But if you have to apply to an unknown place, I don't think you're going to get much.
Carrie, do you have your hand up?
No, sorry, I forgot to set it down.
I was going to let you go first. My reactions as this conversation has been going have been, this is a good conversation. But my suggestion would be, if I were starting this program out, I would make very clear in the RFP, and I haven't read it yet, I just forwarded it, I didn't actually read it. I would make very clear that the RFP, that the grant is aimed at grassroots groups, not at university or academia, and that the strategy would be that the grassroots group apply, and if they want backup from academia, that could be included as part of what's presented. I think it would be a mistake, in my judgment, and I'm very biased about action, to start with an application from an academic setting and then try to involve the community.
Thank you. Thank you, everyone, for engaging and participating in this discussion. I think it gives us some ideas moving forward. For our current RFP that we put out, we encourage, proposals we're hoping to start reviewing in early October. So we have a deadline of October 2nd. If you can share it widely with your networks, and I think that's a really great point, that some of the, best success sort of comes from if, members are connected with some of these organizations, know who to share it with. And so, one of the reasons why I wanted to make sure to highlight this here at the Practice Council, where we're having all these conversations about practice, how can we get these resources to, the organizations that are doing this work and that could use this kind of money. I like the kind of reframe as seed money, because I think that is something that we tried to kind of get across in our RFP, and it was also, you know, we were starting with the amount that we were giving and then sort of defining what it's going to be used for. But Tom also brings up a good point that if we are starting with what our goal is, you know, we really need to think about how we advocate for the appropriate amount of funding to address that goal.
Yeah.
And so I think, you know, there's some ways that, you know, when we think about how we approach these sort of racial justice initiatives, and you know, when we approach it from sort of, you know, thinking about what we've got, but then, you know, being able to take that step back and seeing, well, you know, to like, you know, where is the system limiting us? And, you know, how can we remove that systemic barrier rather than sort of just working with what we've got to do this work. So I think, yeah, this is a really helpful discussion for me. Hopefully sort of it helped in terms of, you know, thinking about action for racial justice and what that means to the group as a whole. And, you know, I'm hoping we can have some more of these discussions kind of throughout SCRA as well to especially as we're sort of thinking about strategic planning around incorporating our values around inequity and racial justice as an organization.
Great. Well, thank you, Sindhia. This was an amazing discussion. You said, well, I'm just going to open up the discussion and we'll see what happens. And it happened. Well done.